Sleep apnea is an extremely common problem. It's regarded now as one of the real sleeping giants of medicine, and sleep apnea can have a huge impact on people's lives. There's so many implications for people with sleep apnea, from risk of heart attack, risk of a stroke, hypertension, high blood pressure in other words, diabetes. There's so many different implications about having obstructive sleep apnea. Sleep apnea is something which starts probably earlier in life, just as what's called sleep disordered breathing, and it may manifest as snoring. In some cases it progresses to the point there where people are witnessed to stop breathing frequently during their sleep. The big problem with obstructive sleep apnea is the fact that the brain's not getting sufficient oxygen during their sleep, as a result of the tongue falling back on the back of the airway or obstruction from the back of the nose. So sleep apnea has traditionally been treated using what's called CPAP, or continuous positive airway pressure, which is a pump underneath the bed and a face mask and sometimes little nasal cannulas and air being pumped through your mouth and nose to keep your airway opened. And while it's still regarded as the gold standard of treatment, research now indicates that there's a significant percentage of the population who don't really comply very well after a period of time. I think the current research is that after 6 months, there's 60% of people are probably only wearing their CPAP for 4 nights a week, on average for 4.5 hours a night. So nowhere near enough protection for their brain and all the other implications about that. So dentists are now regarded as being one of the first sources of being able to diagnose obstructive sleep apnea. When we see certain things, looking at a person's history and looking inside a person's mouth, if we know somebody's a good tooth grinder, if we know somebody's got problems with gastric reflux or heartburn in other words, first thing we'd be thinking of is that person heading towards obstructive sleep apnea, or does that person have obstructive sleep apnea? So what we do is we do a test which the sleep physician would do, a GP doctor would do, various different sleep centres would do. It's called an Epworth Sleepiness Scale. So it's a questionnaire that the patient can answer, and that gives us an indication as to whether or not there is a high risk factor of obstructive sleep apnea. And dentists that know what they're doing with this area can look in the mouth and determine what the oral factors are. Quite often it's things like very large tonsils, a large uvula, a large tongue, narrow airways, and we can determine all that sort of stuff. But from the other perspective, it's quite often a problem with the back of the nose as well. So we work very closely in conjunction with sleep physicians and with the ear, nose and throat surgeons. Quite often the best way of treating it is to have some surgery to the back of the nose to clear the airways. And if that doesn't do the trick, or if the CPAP is not working for people through the sleep physician, then more and more dentists are being called upon to treat it. We do so with devices called the mandibular advancement splint. And an MAS, or a mandibular advancement splint, is a device that's designed to fit your top and bottom teeth, and it pulls your lower jaw forward. In doing that, it actually pulls the tongue away from the back of the airway, and it stops the obstruction that's occurring, so people get clear air through to the back to their lungs. And there's a huge difference in the quality of life. People that may have OSA and are unaware of it may be aware of excessive drowsiness during the day, tending to fall asleep at the most inopportune of times, like in the movies or in front of TV, or driving a car, which is one of the big risk factors. So nowadays there's a lot of professional drivers have to be tested for obstructive sleep apnea to maintain their licences. So dentists are now regarded as probably one of the first ports of call for determining if OSA is an issue.